Hi, I'm Michael Gelb, and it's great to be here with you today. I'm the co-founder of the American Academy of Physiological Medicine and Dentistry, the AAPMD, and also co-founder for the Foundation of Airway Health. And I'd like to just talk about airway for a bit. Been working with Bob Clark for the last 6 months or so, and we're working both with what patients do during the day in terms of their TM joints and their airway, and also how they breathe, sleep at night. I've been involved with TMJ for many, many years, and I've been fortunate enough to have evolved into looking at breathing in the airway and sleep. I find that a lot of my patients, especially in New York City, are exhausted. Everybody's tired. Everyone has difficulty concentrating. People have reflux. People have insomnia. And so I see all these complaints, all these lifestyle complaints, and I think it's amazing that we in dentistry probably are the best profession to address these complaints. We have been talking about this 85-45 campaign because 85% of the patients in every practice, or 85% of the people in this country, are undiagnosed. That means there are kids out there with ADD, behavioral issues, anxiety, depression, inability to concentrate, inability to get along with other kids. These kids, 85% undiagnosed. There's adults out there that are exhausted, that can't focus, their performance is hurt, they're irritable, undiagnosed. We believe that the dental community, that's the hygienist, the assistant, the dentist, because of the amount of time we spend with patients every day in our practices, we are the best ones to be able to identify these patients and allow them to be diagnosed. That's why we work with Williams, because Williams works with the top dentists in the country. We would like the dental community to be able to prescribe or recommend a sleep study, and then because 90% of the obstruction is behind the upper jaw, the palate, and the lower jaw, the tongue, the dentist and the dental team are the best ones to be able to adjust the upper jaw, widen the upper jaw, but move the lower jaw forward in order to open up the airway. And that's what we're doing with Williams Lab. We're innovating appliances. These are appliances that can be worn during the day to open the airway. They're appliances that can be worn at night to maintain an open airway. Once the airway's been opened, we can repeat the sleep study in about 3 months, 4 months, and see if we're increasing oxygen and allowing the patient to get into a deeper stage of sleep. These are really the two things that we can do in the dental community. We allow the patients to breathe better, increase their oxygen, which gives them a better night's sleep. It allows them to get down into a deeper stage of sleep. When they get down into a deeper stage of sleep, they think clearer, their energy is returned, and a lot of it has to do with the sleep architecture. More restorative sleep, stage 3, and more REM sleep. Their memory gets better. And now with older adults, we're talking about preventing or delaying dementia. Because everyone, what's your name again? Where did I put my keys? Starting at age 40, we're starting to forget things now. 45, 50, and we don't know, am I going to be an Alzheimer's patient? Am I going to be a dementia patient? So for my middle-aged population, it's all about, I think, the brain. For my kids, it's about the brain, because the brain is developing between birth and age 6 or 7. It's largely developed. So I need to get the kids treated when they're 2 or 3 years old, before their brain has completed development. So I'm trying to mainstream my children by the time they get into kindergarten, which means the dental community has to intervene early. My adolescents, same thing. I can intervene at 12, 14, 15, 16. So basically, it's from, we say, cradle to grave. Everyone is sitting in the dental chair, whether it's a pediatric patient, middle-aged patient, late adult life patient. These are all people that are candidates for both diagnosis and treatment. And by working with Williams Dental Lab, we can produce innovative results, innovative appliances and products that can be easily worn, they're comfortable, and they allow the patient to wake up refreshed and vigor and lead a healthy, productive life.